Today we'll see what is the difference between a fresh embryo transfer and frozen embryo transfer. Hello everyone, I am Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Today's time, most of the embryo transfer, around 95%, are frozen embryo transfer. There are multiple reasons why frozen embryo transfers are preferred, and there are also some reasons where we prefer fresh embryo transfer. So usually frozen embryo transfers are preferred in patients where there is risk of first OHSS or ovarian hyperstimulation syndrome, usually in polycystic ovary patients where your estrogen levels are gone too high. So in such patients, it is safe for the patient and also for the success of IVF cycle. It is important that we plan a frozen embryo transfer. Other patients who may require frozen embryo transfer are where we need time in between the embryo transfer and embryo freezing to correct some things. Like there might be issues related to your uterus, like there might be fibroids in the uterus, there might be swelling in the wall of the uterus like adenomyosis, or some polyp needs removal, or some hydrosalpinx needs surgery, or if somebody is very overweight, there is also weight reduction which is advised before embryo transfer, or somebody needs to control their blood sugar or thyroid before embryo transfer, because all these factors are going to affect your success of IVF cycle. So in such patients, we prefer frozen embryo transfer. So in frozen embryo transfer, because your body does not have the hormones which to support the pregnancy, we add the hormonal medications to build the lining and also to support the pregnancy. Frozen embryo transfer usually does not affect your success rate. In fact, most of the times it increases your success rate compared to fresh transfers if there are issues which I already mentioned. Now coming to fresh embryo transfer. So which patients we prefer fresh embryo transfer? Patients who have very low egg reserve, where the hormone levels are also suitable for fresh embryo transfer, where there is no risk of ovarian hyperstimulation syndrome. In such patients, we may do fresh embryo transfer. So such patients, we prefer doing fresh embryo transfer. Somebody who requires any genetic testing of embryos, also we advise to undergo frozen embryo transfer, because we need to do the embryo biopsy, freeze the embryos, wait for that biopsy analysis report, which is a genetic report, which usually takes around 20 days to months time. So we have to keep the embryos frozen till we get the report of your embryo's genetic test, which is PGTA. So in such patients also we do frozen embryo transfer. So success rate does not just depend upon fresh versus frozen, but it will depend upon individual selection of the case. So if the frozen embryo transfer is more helpful for a particular patient, we advise to undergo frozen embryo transfer. If it is fresh embryo transfer, then we advise accordingly. I hope this was helpful. Thank you.